Good morning, good afternoon, good day, all. Hopefully you see my slides and we'll carry on. So life in space is different than on the ground. And we have a terminology we call countermeasures, and I'll define that for you here real quickly. And then we're going to kind of go down some of the potential treatments for sands. On the ground, when we talk about countermeasures, it's kind of like talking about primary prevention in space. We want to prevent issues from occurring because once we head off to Mars, we're not exactly going to be able to fix them in space because we have significant limitations. As Dr. Brunstetter has said, we get retinal photography, we do OCT, we do all this stuff on orbit in space, and we have not one single optometry tech, not one ophthalmologist. We don't have any specialists, and they do all this work based on a few hours of training in the months preceding a mission. So we're very limited, very restricted in what we can do. And we also have a very unique working environment. This image on the right is an exercise device that is used in space. It's called ARED. And I would show you this video, but I have a little challenge here. So I'll just tell you that if you go on the internet, and all my information actually I present to you is actually available on the internet. This video here with Station Life will show you the various exercise equipment that we have on station, including that ARED, which you just saw a picture of, which is a weightlifting machine, and it was designed to prevent muscle and bone loss during space flight. It's on the space station. We also have a treadmill on the space station, but the treadmill you have to be strapped into because you float around. If you don't, and you can't walk or run for sure on the space station without it. We also have a bicycle. And the bicycle, just FYI, because the uniqueness of microgravity, has no seat and no handlebars. So it's, I would like to show you the video, but you'll just have to go look this up and see it. But if you would look at that, you will get a good idea. You will get an understanding of the uniqueness of being in space and what our astronauts go through. This video here demonstrates one of the major etiologies we think when it comes to sands. And this is how fluid shifts from the lower extremities while we're here in 1G, 1 gravity, and it'll be squeezed up the vascular and lymphatic system up to the thorax and the cranium. So it goes into the head. So you saw some changes on MRI, and that's where the vascular CSF gets displaced, or ventricles enlarge, and perhaps the optic nerve sheath and the fluid therein gets increased pressure, which goes forward on the eyeball. So we get globe flattening, optic disc edema, choroidal folds. This is a nice graphic, and if it were as simple as this, we may already have it all figured out. It's not quite that simple, and so we're still working through countermeasures and ways to handle this. And here's just a couple more graphics on the visual effects that might occur in space. So that's available on the internet. There's photos on the internet. Here's lower body negative pressure. How many of you ever thought about treating your eye patients with LBNP for short? This specific device is on the International Space Station right now. It is used by our Russian colleagues. It is a Russian piece of equipment, and they use this prior to returning back to Earth to help accommodate or get the human physiology used to 1G again. It pulls fluid down from up in the head and thorax down into the lower extremities. And they'll do this several times prior to return to terra firma. It is simply a vacuum pressure device down on the lower extremities. And there's just a skirt, like if you see kayaking, they have this little skirt around their waist that helps keep the vacuum down low. This can get quite high when it comes to the amount of negative pressure, but it pulls half a liter to a liter of fluid down during its operation. The question for us is, how long would you have to do this to be a real countermeasure for sands? This device, if you notice, he's up against the wall. It does not move. There is no equipment that moves around and provides lower body negative pressure. So how can we even develop this technology to be useful, applied long enough, be safe on the International Space Station, and actually counter SANS? Now, we don't actually know that it is increased intracranial pressure that is at the crux of this problem. So our research colleagues are challenged to put this on their risk list and how much effort to put into a treatment that we don't even know would actually work. By the way, I'll just mention one of the luxuries of the International Space Station is the amount of volume available to the astronauts while living there. When we're talking about where we're really concerned is going to Mars, you're back into the Apollo type capsule and the amount of volume that's in that capsule. And there's just not room for this sort of material. And there's certainly not room for the advanced resistive exercise device. If you want to know more about lower body negative pressure, there are some excellent publications on it. I just simply put up this one graphic, and you should be able to see these slides, and you can look it up. There's a whole lot of information on LBNP, and it's probably our leading candidate on the research side of the house for potential countermeasure to SANS because of that headward fluid shift. This also comes into play. These are simply veno-occlusive thigh cuffs. Russians actually have these on the International Space Station, and they've used them regularly with their cosmonauts when they go to the station, and then I'm not sure if they use them prior to return, but they have applications for this this particular material. It's called a bracelet by the Russians. The particular material you see here actually is research-based. This is an astronaut in space. We can't recognize because of the little eye cover there, which very effectively prevents us from knowing who this is. But down here you see the thigh cuffs, and he's actually not only the operator, but the subject doing his own echocardiography. So these have been evaluated looking at the influence on the cardiovascular system and the heart, and they do actually trap fluids down in the lower extremities. Again, the question is, how long do you wear these and to get a necessary effect on SANS and any of the signs that we might be seeing? A concern with these actually is, what if you're very effective in occluding your vascular system, and will you develop thrombosis now? So will the solution cause a new problem? And that is often the situation on the International Space Station. We do have one countermeasure already in place on the station. A while back, years ago, we attacked salt. When you're go into space, your taste buds change, your sensitivity changes, and you desire more stimulation, basically. And so high salt intakes occurred with our astronauts. So basically, we reduced those salt intakes about 50% on average. You can see it was historically as high as 10 grams a day for some individuals. That was determined to be unhealthy for them, both vascular and for their skeletal system. So that's one activity or countermeasure that's in place already. Another one that's been suggested as potential countermeasure that's relatively easy to do is give them a vitamin B cocktail mix. You can see a list of the vitamin Bs that might be involved in this mix. And on the right is a graphic, a bit of an eye chart perhaps for you, that shows the various vitamins listed on the left and where they fall into this particular one carbon metabolism cycle. There seems to be some genetic predisposition in some individuals, perhaps, to develop SANS. The genetics is kind of hidden down here, but I have a couple links in this slide set. There's a genetic situation called a single nucleotide polymorphism, commonly called a SNP. And SNPs can happen after you're born. There could be some genetic birth based genetic problems that actually predispose an astronaut for SANS. However, we do have an issue here in the US, and it's called the Genetic Information Non-Discrimination Act, which kind of limits what we can do with our astronauts and what genetic information we can utilize. So it's been an area that's a challenge, and instead of actually doing genetics, we basically recommend this cocktail mix. It doesn't prove, it doesn't help us know if this is a solution or not. Generally speaking, it's easy enough to institute in a non-exploration class mission. So on the ISS, we can do this. Going to Mars, actually, this is a challenge. If you're going to put a bunch of pills on a spaceship, you got to have room for them. And if it's a 3-year trip, how long are these good for on the vehicle? Usually it's not for 3 years, but that's a challenge. So dietary changes have been enacted, and some are in play, including this one, which is being evaluated in some ongoing research. When it comes to medications, we don't have a lot of choices. You know, we've used idiopathic intracranial hypertension as the standard for us in the past to get ICP reduced. It's a no-go really on the space station, a lot of side effects, a lot of problems. And we've never treated anyone on the station, and I don't really see us doing that. There is one out there that's a possibility. It's in study right now in human trials in the UK with Doctors Mullan and Sinclair. You can look that one up. But they're using GLP-1 agonist perhaps to reduce ICP, so it's got some promise. And it's got a much better side effect profile compared to ACTZ or acetazolamide. Finally, I'm going to mention this kind of as one of those contestants that's out there. I haven't seen it in a while, but there's this question about a relative ocular hypotony, the IOP to ICP translaminar gradient. Perhaps there's some relative shift up there. And an individual came up with really swim goggles with some pressure tubing that was attached to it to an attempt to put a little pressure on the eyeball from the outside, see if we can increase IOP and maybe affect the translaminar gradient and rid us of this relative hypotony that happens in space, and use that as a countermeasure. So there are several other things, but time limits us about those discussions. Perhaps we'll have questions at the end, and I will turn it back over.
Thank you very much. We do have a time for a couple of questions here. One, maybe to start with, you mentioned a couple of countermeasures, such as lower body negative pressure, some pharmacological ideas. Have any of these been evaluated against some of the symptoms that Dr. Brunstetter talked about, such as cotton wool spots or the choroidal folds in terms of their effectiveness against SANS?
My initial response is really no. There are a very limited number of cases to work with in the first place. And maybe Tyson could answer it with a different answer, but there's a lot of research-based evaluation going on, but we've actually treated only one astronaut in all our years and it was with acetazolamide several years back. Haven't treated anyone in the acute post-flight period with anything that would treat the signs that we see with SANS. Would you agree, Tyson?
Yeah, I agree with that. And when we talk about countermeasures, we really have to talk about research and clinical. And the clinical thoughts and theories drive the research, but the research is really what proves what countermeasures may be effective. And so that's really the stage that we're in. There's a lot of work with countermeasure research, especially using head down tilt studies. There's a facility, the MBHAB in Germany, that's looking more closely at this, looking at lower body negative pressure, the bracelets, and other medications, for example. But yeah, I agree. On the clinical side, we have to be incredibly conservative because we truly don't know what we're treating. We don't want to just throw things on the wall and hope that it sticks.